Today, we are going to get into a really critical medical device called a ventricular shunt. It's used for a condition called hydrocephalus, which is, when you boil it down, basically a plumbing problem in the brain. My goal here is that by the end of this, you'll know how these devices work and, even more importantly, what warning signs to look out for so you can feel confident and informed.
So let's just ask the big question right off the bat. How in the world do you fix a plumbing problem inside the human brain? I know it sounds like something out of science fiction, right? But it's a very real medical challenge, and it has an incredibly clever solution. Let's dive in.
Okay, so before we can even talk about the fix, we really have to get a handle on the problem itself. Our first stop is the condition that makes the shunt necessary in the first place, hydrocephalus.
So what is hydrocephalus? Well, it's what happens when too much of a special fluid called cerebrospinal fluid, or CSF for short, builds up inside these natural cavities in the brain called ventricles. The easiest way to think about it is like a blocked drain in your house. When that fluid can't flow the way it's supposed to, pressure starts to build up, and that pressure can get really dangerous. So if the problem is a blockage, what's the solution? Well, you create a new path for the fluid, right? A bypass. And that's exactly where the ventricular shunt comes in. It's a truly elegant piece of medical engineering.
At its core, a shunt is a super sophisticated internal drainage tube. It's surgically placed to reroute all that excess CSF away from the brain and into another part of the body that can just safely absorb it. The whole point is to relieve that dangerous pressure.
Now, here's where it gets interesting. While the basic idea is always the same, drain the fluid, the destination for that fluid can be different. This brings us to the four main types of shunts, and each one has its own unique drainage path.
So here they are, the big four: the VP, VA, VPL, and LP shunts. And like I said, the key difference between them is just where that fluid ends up. Let's break them down.
First up is the ventriculoperitoneal, or VP shunt, and this one is by far the most common type you'll see. Why? Well, it drains fluid from the brain's ventricles all the way down into the peritoneal cavity. That's the space inside your abdomen. That area has a huge surface and is just fantastic at absorbing fluid, making it a super effective and safe destination.
But sometimes the abdomen just isn't a good option for one reason or another. In those cases, doctors might use a ventriculoatrial shunt, or VA shunt. This type takes a totally different route. It redirects the fluid right into the bloodstream, specifically into the right atrium of the heart, by using a major vein in the neck. Okay, so what if both the abdomen and the heart are off the table? Well, there's another backup plan, the ventriculopleural, or VPL shunt. If neither of those other sites will work, this shunt sends the CSF into the pleural space. That's the little cavity in your chest that surrounds your lungs.
And the fourth type, the lumboperitoneal, or LP shunt, is a little different from the rest. See, it doesn't start in the brain's ventricles, it actually starts lower down in the spinal canal. From there, it drains fluid into the abdomen, just like a VP shunt does. This one is often used for very specific types of hydrocephalus.
Okay, we've covered the different types. Now, let's get to what is, honestly, the most important part of this whole conversation, the universal warning signs. It does not matter which shunt a person has. These are the absolute red flags that something might be wrong. These are the signs you've really got to commit to memory. We're talking about a headache that just will not quit, vomiting, being unusually irritable or sleepy. Seizures are a big one. And of course, any signs of infection, like a fever, or if you see redness or feel tenderness right along the path of the shunt tubing. Any of these symptoms, and I mean any of them, warrant immediate medical attention.
So, beyond those universal signs, each shunt type also has its own unique set of potential complications, and it all comes down to where it drains. This is exactly why knowing the specific type of shunt is so crucial for staying on top of your health. Let's look at them one by one.
For the most common type, the VP shunt, the warning signs are totally logical. Where does it drain? The abdomen. So what are you looking for? Problems in the abdomen. Things like belly pain, swelling, and other signs that there might be an infection or a blockage right in that area.
Now with the VA shunt, the red flags are completely different because it drains near the heart and into those major blood vessels. So you have to be on the lookout for things like swelling in the neck, maybe an irregular heartbeat, or even serious infections that can spread through the whole body since the device provides a direct line into the circulatory system.
For the VPL shunt, remember where it goes, into the chest cavity. So naturally, the warning signs are all about breathing. We're talking about shortness of breath, chest pain, or a cough that just won't go away. This could be a sign of a problem like a pleural effusion, which is just a fancy way of saying there's excess fluid building up around the lung.
And finally, for the LP shunt. Because that catheter starts in the lower back, you might see low back pain, or even that shooting nerve pain that goes down the legs. And since it also drains to the abdomen, all those same belly symptoms we talked about with the VP shunt are also a concern.
Whew. Okay, we have covered a lot of ground. We've talked about the problem, the solution, the 4 different types, and the warning signs for every single one. So let's just boil it all down with a quick, concise, clinical summary.
So, what's the bottom line? The key takeaway is this. The VP shunt is generally the most common and safest option overall. The other shunts are excellent alternatives when they're needed, but as we've discussed, they each come with their own very specific risks that are related to their drainage location, whether that's the heart, the lungs, or the spine.
And we'll end here. You know, the goal today wasn't to diagnose anything, but to empower you with knowledge. You now understand the core ideas behind ventricular shunts, and most importantly, you know the signs to watch for. So the real question is, what will you do with this information? Is it maybe time for a more informed conversation with your doctor?